Question from Sally. I think she's talking about blood type because she goes O plus. So I'm guessing that's O positive. And she says, we use up taurine very fast, which is provided from organic grass-fed beef. I lose weight on a plant-based diet and feel better, but I go into a depression. And as soon as I eat even 3 to 4 ounces of grass-fed ribeye steak, my body pulls me right out of the depression. Any help with this would be appreciated. Or am I just one of the few that just need to eat 3 ounces of meat twice a week?
I think she's confusing the word depression with addiction, because depression takes weeks to go into depression. When you give a person a drug, for example, to help them with depression, or to give them SAMe or saffron or fish oils, it takes many weeks to get them out of depression. And when you put them into depression with a chemical depressive, something with a depressive side effect, it takes many weeks or months to get them into depression. So it takes time. So she's getting instantaneous feeling bad when she's feeling better when she has something like an animal product, and she's feeling worse when she doesn't have animal products. And of course, we know animal products are difficult to digest, and they have put a lot of stress in the digestive tract. So they add a lot of toxins to the body, and it's a big workload for the body. So the body can't detoxify and heal itself when it's digesting animal products a lot at the same time. So it's like you feel better from the withdrawal from smoking. In other words, if you take another cigarette, you're going to ease up your way you feel. Stopping an addiction, you feel worse. It could exacerbate anxiety, even withdrawal depression, when you stop something you're addicted to. And you can feel better by having another cup of coffee, by going back and having more alcohol, taking back the sweets again, going back on the meat again. You temporarily feel better. But how you know it's addiction and withdrawal from your addictive substance is that you can see it's happening relatively quickly. This is not a lack of a nutrient causing depression. That would take months or years to occur, not days or immediately feeling better. So the fact is, when a person stops having meat, they start to go into a deeper phase of detox, and that could mobilize toxins in their body that could make them feel fatigued or anxiety, or even go through some withdrawal depression. And she has some nutritional imbalances that are causing this, and she's rationalizing to think it's the lack of taurine that's causing it, which is a confusion. She's been told that by somebody in the carnivore movement or something, And if that was the case, if it was taurine, she could just take a few taurine pills, and still be on a healthy diet. But it's not the taurine. It's more complicated than that. I don't think taking taurine as a supplement would help her. Even if she took 500 milligrams of taurine, every hour, she still would not stop the withdrawal from meat, from taking meat out of her diet. So she's probably, it shows you how bad meat is for her, that the minute she doesn't have it, she starts to feel symptomatic. It shows you that how it's causing a major problem with aging and damaging her body. And of course, her blood type has nothing to do with that. So she's just, but in any case, it would be fun to work with that person and to, give them some supplements, maybe some extra taurine and plant-based proteins such as hemp seed or pea protein, and make sure she's getting those nutrients that she thinks she's missing, and make her and clean her diet up and give her the extra things that help with depression, like saffron, SAMe, and 5-HTP, and making sure her omega-3 index is adequate, and then actually have her detox off this meat-heavy diet and see if we can get her being able to go on to a healthy plant-based diet that will afford her the ability to stay out of depression, not have ups and downs, and to live a long life simultaneously, because now she's in a vicious cycle that's going to lead to a tragedy in her life.
So you said you'd be fun to work with this person. Did it mean coming to the Eat to Live Center retreat, or is there other ways people can work with you?
I was referring to my past life when I really did see patients. But no, she could, I don't want to make it seem like people have to come to my retreats and spend the money and time to work with me on something. They could, if they need my advice or help, they could just join the website and ask me questions, and they ask the doctor for them. That's the most economical way to do it for people,
Yeah. I'm wondering, I'm not a doctor, but I'm wondering, because in her question, she said that she loses weight on a plant-based diet and then she needs to add meat. You've often said that feeling better doesn't mean getting better. You said that a lot, like with medications. But do you think maybe her diet is too low in caloric density, and the meat is, because meat is much higher in caloric density than fruits, vegetables, whole grains, and legumes? And could she be just craving more calories? Because sometimes people don't eat enough when they do a plant-based diet.
That's so rare. In other words, Yeah, there are people who are like anorexic and but nah, I don't, that's very unusual and I wouldn't expect that's most likely, but that's likely, but we could look at, but if she was really super thin, that could be the case, but she might need more fat in her diet or more protein in her diet, but I doubt it.
Yeah.
She's,
Well,
I think this, I
you
think
brought
it's,
up a good point, because even people that are like take antidepressants, they don't feel better after the first pill. It takes a while.
yes, it takes many weeks for him to feel better.
And
Because
she's
you're
saying
practicing
that the
brain
meat,
body,
go
brain
ahead.
chemistry. You have to change brain chemistry. You can't, the chemistry is not going to change. And nutrients don't even change things that quickly. You can't change how you feel that quickly unless you're causing addiction type flux.
Right. Yeah. Yeah. Because she said she immediately lifts her out of depression. Okay. Okay. So